Global health leader and former United Nations diplomat Professor Paul Lalvani is the founder of the Empower Group, a global organization strengthening health systems in over 40 countries through capacity building.
Ladies and gentlemen, good morning, good evening, wherever you are. My name is Alex Mejía. I'm speaking to you from Geneva, Switzerland. Today is a special day for us because we have Professor Paul Lalvani, someone that I greatly respect, someone that has a vast and successful and more than relevant experience in the multilateral and international arena at the World Health Organization, at the Global Fund, at the Gates Foundation, and now a very unique role that he has. He's the founder and executive director of Empower School of Health, a beautiful organization that we respect at the United Nations, and particularly at UNITAR, doing a great job in building capacity, as they say, building capacity where it hurts, where it's needed. So today we will be talking to a practitioner, a great professional and a diplomat, a man that understands geopolitics and that understands capacity building and education, a man that understands the very many intricacies of public health, and perhaps most relevant, a man that many will see as a very wise man, a man of emotional intelligence. So talking about leadership with someone like Paul, Professor Lalvani, it's a great privilege, as I say. So let me welcome him to Geneva and to this interview. Paul, it's a pleasure to have you with us. Let's go right there with the first question, if you allow us to.
Thank you, Alex, for
Indeed.
the kind introduction. Thank you.
Our pleasure. So tell us, who are you? Before we get into the professional life, who is Paul Lalvani?
Who is Paul Lalvani? Given that we have limited time, let me focus on the key elements. So from a personal level, what shaped me is where I grew up. So the first decade was in India. The next decade was between Africa and the UK, so Nigeria and the UK, so very much both developing and developed countries. Most of my education and initial work experience was in the United States. And then thereafter joined the UN system, where I got a chance to work in very challenging environments and countries in the Southern Hemisphere, from Afghanistan to Yemen to Papua New Guinea. And then over a period of time, had a chance to work at the board level, at a strategic level, based out of Geneva. So really a vast, vast set of experiences. And it gave me a chance to see what the world needed, and hence it led to Empower School of Health.
Excellent. And that's a good segue for the second question. Tell us about Empower School of Health and the vision that you have for it, which is more important.
No, thank you for that. So the exact vision and mission for Empower, at the top it says empowering millions, because unless you bring scale, you're not going to change the world. And the mission specifically, the way we've shaped it for ourselves, is transforming the way people learn, work, and save lives. Learn, work, and save lives. And over a period of time, what we noticed is I had worked in a technical environment, I'd worked in a financial environment where we had lots of funds to give away. And what we noticed was money didn't make the difference that we needed to make. What really started to make the difference was when we empowered, when we transformed individuals, and when we transformed institutions, where we could see sustainable change. And that was really the reason for creating and even naming the organization Empower, and Empower School of Health, where we focused predominantly in health.
A beautiful vision and mission, a commitment that you have. But let me go before that to the Global Fund, an institution that is achieving high impact around the world, where it hurts, as we were saying, where the multilateral organizations are more needed. So in 2004, you served as head of supply chain management at the Global Fund in Geneva. How did that experience influence your understanding of the challenges involved in delivering healthcare resources effectively on a global scale?
Yeah, very good question. The time when I joined the Global Fund were the early days. We really, the time when I was there, we were only about 60 people, 50 to 60 people. And we really shaped the policies of what Global Fund was doing and going to do. And within that, the division that I was leading, the procurement and supply chain division, occupied about 40% of the overall budget. And it was focused on HIV, TB, and malaria, ensuring there's funds available for the countries to procure, distribute, and effectively utilize these commodities. And this is what was saving lives. It was a tremendous mission. And the donors from all over the world, especially developed countries, were funding the bilateral missions and some private foundations. 40% of that budget was in procurement supply chain. And half that money we could not spend because of the gap that existed at the country level. And we had a wonderful phrase, performance-based funding. Countries perform, we give you more funding, continue to implement. But the challenge that created was countries that didn't have the capacity, weren't able to implement, weren't getting the funding. So in fact, we were hurting them twice. So the focus and the initial thought really was, well, if we help them build their capacity, they'd be able to then accordingly implement better and do more with the funds. And that was the initial thought for Empower School of Health.
And something that will allow us to dwell into capacity building proper after all this interview is conducted here at UNITAR in Geneva. So let me ask you, why do you believe capacity building is essential in global health? And what specific gaps did you intend to address when founding Empower?
So if you look at WHO's key pillars for a health system, the workforce, human resources for health, is one of the core pillars. You don't have that, the health system won't be able to stand, scale, implement. So the idea of bringing sustainability and the idea of bringing any kind of both scale and sustainability and quality needed at its heart people. And very much in terms of when we say people, people are sitting in institutions. And institutions are part of overall organizations, whether it's ministry on the public sector side or the private sector side. So the idea was, how do we target the right individuals, depending on if we are focused on health and supply chain, then these are individuals that could be in the regulatory authorities, in the ministries of health, or the central medical stores. Now, if you're targeting individuals that are on the provider side, then you're talking to doctors, you're talking to nurses, frontline workers, community health workers. So depending on whom you're targeting, the appropriate individual and institutional strengthening needs to take place.
Tell me, how should we see all the challenges to multilateralism, particularly to the WHO, vis-a-vis the great need for an organization like the WHO. The WHO, you can criticize it as much as you can, but nobody can say that these guys are absent, that they are not on the ground where it hurts, as I say. And more important, perhaps, that no one will be able to argue that they are not helping people by the hundreds of millions, if I may say. So how should we see this crisis of multilateralism and what's happening to WHO?
Fantastic and very big question. And let me answer it from my perspective of capacity building, strengthening, etc. What WHO brings and where it is known for its leadership is from the normative side of things, bringing critical policies to the table, to the world. Policies, manuals, guidelines. It really sets the stage for that. And this is across, whether it's NCDs, non-communicable diseases, communicable diseases, or any of these areas, emerging areas, from digital health to AI. It shapes many of these policies. And yes, you can criticize WHO in many ways, but this really is their core function, where it brings together scientists, it brings together opinion leaders, policymakers, to shape some of these discussions and dialogue. The idea is now, and I've had these conversations with WHO and many of the WHO representatives in country, in the regions, where what they've asked us is all these really critical policies, manuals, and guidelines. How do we take them to the countries? How do we take them to the ministries and to the implementing individuals and the departments? And so if you really think of, I have a supply chain background, and I really see knowledge as a supply chain challenge. Mm-hmm. So policies, manuals, guidelines shaped at the global level, moves to the regional level, moves to the national level, but then to really implement and execute how a particular diagnostic needs to be implemented, used, delivered, or a particular product needs to be introduced, or when, for which condition. It's both a supply chain from a product point of view and a knowledge point of view. And so that complementarity of working closely with an organization like WHO, and if you remove them from the dialogue, from the space, there's going to be a major void. So as we move forward, we need to pay attention to that.
Very much so. And in this third decade of the 21st century, very many things that we took for granted when I was a young diplomat, I do remember that to think that a member state will be challenging the United Nations system as we see it today, we will have said that the likelihood was very rare. Not rare today. We see multilateralism really put into a difficult perspective. And that leads me to my second question. In general terms, this is a friendly conversation, but a man of your experience will certainly have an idea on the UN as a whole, the United Nations system as a whole. You have been part of the system, of course, I'm very senior in it. How do you see the need for an organization like the UN in the future?
All right, so now you're really stretching my planned interventions here. First of all, when we say the United Nations, we're really talking about, 70 different organizations that we're referring to. I believe some of them will, over a period of time, cease to exist, depending on their relevance. Mm. I believe some of them will transform into becoming more relevant. We know that, for example, climate, peace, water, people, those areas will absolutely need to be strengthened and focused on, health being vital. So another 20 years from now, if we also go back 50, 70 years, there was no United Nations, or at least there weren't these many. So they were created for a particular need. Some of them may cease to exist because either they've met their need or they've been reshaped into something else or merged into something else.
Very much so. If you're interested in trying to understand the UN system and UN reform, because every organization is subject to reform as well, but an organization that remains as relevant as Paul has shared, do read this book. It's called Parliament of Man by Paul Kennedy. It's a fat book, as one of my daughters would say, but a very valuable one, even if it is 20 or so years old, because it will make you think that, I'll tell you the conclusion of Paul Kennedy to echo what you say. 800 pages later, at the very end, these very reputed authors say, if the UN wouldn't exist, if it didn't exist, humanity will need to create it. As simple as that, because we do need to have an organization like this, where no matter how big or small your country is, it has a voice. So let me switch to the second part of this interview, which is perhaps the most relevant on this series called Learning with Leaders like you. So can you give us, based on your vast experience, how do you define leadership? What is leadership?
For me, leadership is the ability to see the unseen and then make visible, not just for ourselves, but not just for myself personally, but for the individuals that we are working with and the individuals we are trying to impact and reach out to.
Excellent. So a leader has to have a vision, have to see what is unseen. A leader has a responsibility because he has to bring it to the people that he or she influences. And a leader has a role to play. So let me go back to Empower School of Health. You should be very satisfied. This organization that you have created is doing great work around the world, as I say. This is why UNITAR has a very successful partnership with you and your team. But going back to that, how do you, in practical terms, understand your definition of leadership through service? Because you do serve many people by the thousands. Is there a link between leadership and service?
I believe those absolutely need to coexist. Leadership is not for yourself. Leadership has to be for the people and the community at large. And having worked in the private sector, and the reason for my transition out of the private sector into the work I did when initially the first project was with the World Bank, and everything else I did thereafter with WHO and the Global Fund, I couldn't believe there was a job that was so well suited to what my mission and vision, my personal mission and vision, which is bringing large-scale access to quality medicines to every human being on this planet. So you absolutely need to have a service component to leadership. So thank you for phrasing the question in that way, and that is, it's really, for me, it's two sides of the same coin.
Well, let me talk about emotional intelligence. When we touch upon leadership, and we do train leadership at UNITAR all over the place, it's a great privilege for us, mostly to young diplomats or young government officials and so on. But when we come to emotional intelligence, everyone, I haven't met one person out of thousands all over the world, literally. I would say more than 70 countries where we operate as UNITAR and so on. Not one participant that will tell you, I don't have emotional intelligence, or I believe my emotional intelligence is perhaps low or shallow and so on. So let me invite you to share some ruminations on why emotional intelligence will be important, how you define emotional intelligence vis-a-vis leadership. So, is emotional intelligence relevant for a leader?
Emotional intelligence is vital for everyone, whether you are starting out, actually let me start even earlier. I speak a lot at the high school level, and more, both in developed and developing countries, there's a focus on social emotional learning. And from 6th grade onwards, they've started to do that. Realizing that kids at that level, once they start to at least understand what are those components of SEL, social emotional learning, and as they grow, they'll realize how they need to apply it and deploy it as well. So learning from it, and my children went through SEL classes. If you look at your teams, your departments where you're working, and you'll know those who have and those who don't have it or have less of it, etc. As an individual level, the most, if you think of emotional intelligence, and you had to summarize it or shorten it into a rule of thumb, at least for me as a leader or as a head of an organization, is when my emotional buttons are pressed, can I take just a moment to pause, to reflect before I react? And realizing that what are those components helps me respond more, not just effectively, but in a manner in which I'm listening to the other individual. I may or may not agree with that person. That person may have, as I said, pressed one of my buttons, which makes me realize, why do I have that button in the first place? And helps us both at the professional level and at a personal level.
Many of the participants that come to this leadership training, leadership skills, we have fundamentals of leadership, advanced leadership, leadership in the public sector, leadership this, leadership that.
Right.
when we try to establish the correlation, the high correlation between leadership and emotional intelligence, we boil down to these two little magical words: self-control. And you are giving me an excellent example of you exercising self-control if someone touches on your buttons. I'll go beyond that, and I'll tell you where it hurts. We also build capacity on anti-corruption, on how to prevent corruption. And I'll tell you something. One of the core tenets of this is that in addition to the legal framework, we have a global convention anti-corruption. In addition to all the controls, checks and balances of a government, in addition to this and that, it boils down to the individual having enough emotional intelligence and self-control to say no. And a person of integrity, I will never do this, even if the opportunity is there, even if someone is trying to take you to that. So it's so important, self-control, that I have to ask you, from your culture, now let's go to your culture and your upbringing. How do you see self-control and how do you exercise it?
Well, originating from India, many people say Indians and Italians are very similar. We're very passionate people, especially North Indians. We're always expressing ourselves, and we speak off the cuff, as we say. And in terms of self-control, in terms of that discipline that is needed, You've heard about what India has had to offer the world from a yoga point of view and from breathing point of view. And that brings a tremendous amount of discipline. I'm not a regular practitioner of yoga, but I'm a regular practitioner of breathing and mindfulness. And that has made a tremendous difference, both in the evening before I go to sleep, having journaled my entry of what's happened during the day, and first thing in the morning, before the day takes over, before the little beeps start coming on the phone and everything else, is taking that moment to breathe, to reflect, get ready for the day. And that then carries on, realizing that you're listening to your breath, and realizing that you're able to slow your breath, which then slows your heart rate, which then allows those thoughts and emotions to subside. Really does help with that listening to yourself and the self-control.
Fascinating. And I'm learning a lot, and I thank you, and I'm sure you too. So unfortunately, as always, we are running out of time. I'm going to simply to invite you to share a message, particularly to young people, young diplomats, young professionals, even people in high school. We have thousands of people that watch these UNITAR channels, including on YouTube. And I think this will be very beneficial, that a man of this level of wisdom can share some suggestions.
At Empower, we have the Center for Leadership Development. It's headed by an incredible individual of ours who's Senegalese French, Henri Foucault. And a man of tremendous emotional intelligence, and part of the work that he does and has done with thousands of people is on first mapping what does, just like an MRI or an X-ray, mapping where you are today in terms of your emotional intelligence spectrum, and what helps you excel, what holds you back. And we've done this exercises with leaders, UN diplomats, country leaders, ministers of health, and more we're starting to work with youth as well. And about a week ago, I was at a high school speaking to 11th and 12th graders who are getting ready for what next, the college, career, etc. And all of these individuals were picked from low-income, rural environments and given a full scholarship. And this foundation has been doing this for the last 15 to 17 years. It's based out of India. And this academy, Vidya Gyan Academy, has these kids who would have probably had to walk an hour to a government school, which probably didn't have enough infrastructure, not enough teachers, a library that probably didn't have any books, that environment. Now, these kids over the years have ended up at the top institutions like Stanford, Harvard on one side, but even within India, the IITs and the other top universities. So really brilliant kids. Talking to them, and what I understood last week was we asked individuals, all right, so where do you see yourself in future? Are you going more into technology or IT or law and engineering? And then I had a group set that had undecided. And so people went to their various corners. It was voting with your feet. You weren't just sitting there. And there was a reasonably large group in the middle who were undecided. But as we spoke to them, they weren't undecided. Most of them were multidisciplinary. They were saying, well, I want law, but I want to bring technology into it. Or I'm in finance and accounting, but I want to find a way of bringing some other component to it. So as we move in the future, in our generation, it was okay to be verticalized. And you were probably good. You'd have a degree, a bachelor's degree, a master's degree, maybe a PhD, and you were good for life. Mm-hmm. This generation knows it has to reinvent itself every 5 years. And if you're multidisciplinary, you're more likely to succeed. So that's one key message to youth. And as you grow, don't think in a vertical manner. You have to think cross-sectoral. The other group that we worked with are the top university students out of medicine, pharmacy, and nursing. 13 countries. They were invited to a Gallian Afrique Forum, which happens in Senegal once a year. I'm one of the key organizers of this event. And about almost 200 people get together every year. There's now alumni of about 1,000 of these really top-class individuals. Mm. And the idea is to encourage them. A future Nobel laureate is going to come from these individuals, from Africa. And it's actually guided and run by the top Africans. Many of them are Nobel laureates themselves who attend this event, and the top world leaders as well from the top institutions. And again, for them, it's about bringing in those cross-disciplinary, leading, pushing the boundaries, innovating. So the future really is youth, and what we are seeing out there today in this environment, and whatever we can do to support them to achieve their targets would be amazing.
A beautiful way to close. The future is youth, and a youth that is well prepared and multidisciplinary. That's something that I really appreciate from you, because you have this unique view of a global transformation of this planet. Mostly from the health realm and multilateralism, but also working in so many different cultures with so many different people. Congratulations on what you do and on the time and effort that you invest in youth. So, having concluded this interview, now we would like to invite Professor Lalvani to leave a legacy here at UNITAR and to sign this most beautiful banner that we have here with a message that will stay over time. Paul, thank you very much.
And thank you to UNITAR and your partnership with Empower School of Health. We're looking to expand this more into the areas of youth leadership.
Looking forward to it.
Thank you.